Now, with the state government's buyback of the Northern Beaches Hospital from Healthscope, concerns growing among its doctors about what the new model of care will look like. Local MP Sophie Scomps had an emergency meeting with doctors at the hospital last night. She says some feel like they've been left in the dark and some specialists are already leaving the hospital. The member for Mackellar is here along with a specialist obstetrician from the hospital, Dr David Jollow. Welcome to Drive. Thanks for your time.
Thank you.
Thank you.
And Sophie Scomps, great to have you back.
Thank you so much.
Sophie, let's start with you. Firstly, can you give us an idea of how private and public services are currently intermingled at the hospital and how that currently services patients?
Yeah, so just more broadly, our health system in Australia obviously consists of both public and private services. Both are important. They're two parts of a whole and they complement each other, and really both are required to have comprehensive care. So what is different with the Northern Beaches Hospital is, as you know, most commonly you have public services in one hospital and private services co-located very closely by in a different building. What's different in Northern Beaches is it's all within the one building. So it's a little bit more inextricably linked, and to untangle that is a little bit harder, but it was set up in such a way that it could be untangled. And so the doctors, as you'll hear from Dr Jollow, have provided a model for the government that this can be, that both public and private services can continue to be delivered at the hospital.
So, Dr Jollow, what's this model that you've proposed?
So I suppose what we've really done is decided to go along with what the plan for the hospital was in the first place, is because, as you're probably aware, Chris, the hospital was designed to be split apart in 20 years' time. And really what we're talking about with the government buyback is to actually split it up earlier than that, so that we can be in a situation where we can continue to provide all of the services for the community that Northern Beaches Hospital currently supplies to the Northern Beaches area. So at the moment, like Sophie said, they're all quite intermingled, but we think that we can separate them quite successfully and continue to do everything that we're doing now for everybody.
And what does that separation involve?
Well, like we said, the hospital has actually been designed to be separated. So it's things that the public system does very well, like the emergency department and maternity and paediatrics where I work. The public system works exceptionally well to look after emergency type care, but then hopefully we get into a situation where the private system can continue to look after private elective surgical patients so that they don't need to go on the public wait list locally and don't need to leave the area to get looked after.
So if it's relatively simple to do, what are your concerns?
Well, I suppose the main concern really is we don't know what the plans are. We know that the government's decided to buy back the entire hospital, and we welcome the government providing the public services into the future. But at the moment, we're still waiting for clarification about what services we'll be able to provide. And the concern is that if the hospital becomes completely public, like is what we've been told at the moment, then a lot of the services we provide will no longer exist locally.
So why can't they exist? Why can't they coexist, Dr Jollow?
Oh, that's what we actually want them to do. We want them to coexist. That's exactly what we're planning. We're not asking for anything new or different. We're just asking to continue the way we're doing it at the moment. I suppose the concern is that a lot of what the public system does very, very well, like Sophie said, we need to have a private system working alongside to look after all of the patients that we can. And the concern is that a lot of the private services that we currently provide to the community will be lost.
Dr Scomps, as a local MP, what are your concerns here?
Well, it will be a devastating loss for our community if we lose those private services. And we know that the specialists there at the Northern Beaches Hospital have spent 7 years building up what are world-class services, private services that really complement what goes on in the public hospital. So it will be a great loss to our community. And it was really good to hear at the meeting with all the doctors last night exactly what it would mean. And it would mean things like women who have breast cancer, unable to get their surgery done locally. And you think about if there's no private hospital in our area, we have 77% of residents on the Northern Beaches have private health insurance. So they do rely on this private services. And it would mean that people would have to travel long distances out of the area to get that care. And we know that people who are treated locally do much better. And if you think about it, we don't have the best public transport infrastructure on the Northern Beaches. It would mean long trips for people if they were to travel to, say, North Shore or the Sanitarium Hospital in Wahroonga. Or it would mean $300 or more on a round trip on a taxi. And that is just not sustainable. But The doctors have spent many years building up these fabulous services. It would be a massive retrograde step to not keep those services, and it would be a great loss for our community.
You've said that some specialists are already leaving the hospital. In which disciplines are you aware?
I think, yeah, so doctors do have to have, what they're trying to do is provide certainty for their patients. So they need that continuity of care. And if you consider, if you have, if you're an obstetrician, you need to be able to book your patient in maybe 8 months in advance. And so having this uncertainty as to whether these services will exist at the Northern Beaches Hospital, even, from the middle of next year, it's not good enough. So doctors are having to move lists and are looking at other alternatives to make sure that they are able to provide that continuity of care for their patients. It's all about looking after their patients.
So, Dr. Jollow, are doctors happy about the government buyback of Northern Beaches?
I think it's mixed emotions, Chris. I think we're very happy that the public hospital component of Northern Beaches has been taken back by the government, and everybody's supportive of that and wants to work with the local health district to make sure that works appropriately. But like we said before, we don't want to lose some of the services that we can already provide, and that's what's making people a bit upset at the moment. Because
have you approached the government to ask them what's happening?
We've approached the government multiple times, and we've been trying to speak with the local health district and also the Minister for Health. Luckily, we're in a situation where the Minister for Health is going to come and talk to us tomorrow night, which is great. But considering this has been going on for a couple of months, we've had great difficulty getting any consultation process with the local health district. And to be completely honest, we've had to go to them every single time to talk to them about our concerns rather than coming to us and asking us how we think things would be worked best in the future.
And Dr. Scompso, I assume you've made similar representations to the state government and also to the local area health service?
Oh, yes, 100%. I've been knocking on their door non-stop. But, it really, the medical staff at the hospital really should be consulted because they know they're the ones on the front line that are delivering these services. They should be consulted, but also there should be that certainty. There's a great deal of uncertainty and it's causing a great deal of consternation amongst both the medical staff but also for our community.
And is this because the government's just trying to work out exactly what it's going to do? I mean, would the government, to be fair, need a bit of time to figure it out?
That could be the case. That actually could be the case. And, from my conversations, it sounds like the Minns government does understand the importance of retaining our private services. But the issue is, I think, particularly for doctors, that there's been this lack of consultation and there's just a deep lack of uncertainty. Of course, that void creates issues, and it's meant that because of that uncertainty, doctors are already having to move lists and are making that decision to leave the hospital and move elsewhere where they can have certainty about delivering their services.
It seems bizarre to me that Dr. Jollow, they just blow you off. Like, what are they saying to you? Oh, so we'll get back to you? Well, what's the response been when you've said, hey, we want to contribute here, what's going on?
Well, the blowing off's probably a little bit of an exaggeration, but we've been trying to have discussions about what we think should work for the future. And unfortunately, the news getting back to us is really, we're just looking at it, we're trying to figure out what's going on rather than actually talking to us about what we think might be the best way to do things and getting some ideas. And it's not only the doctors, but it's also the nursing staff and the allied health staff and, and the local executive who know how to run the hospital, trying to get that sort of feedback to figure out what the future could be so that we can all plan how things are going to look for in the future. It's just been a bit difficult, unfortunately.
So what are the priorities in your discussion with the Health Minister tomorrow?
Oh, look, I think like Sophie said, a lot of the priorities revolve around the private service that we currently provide, and the concerns are that we could lose the breast surgery service, like Sophie said, but also paediatric surgery, neurosurgery, interventional cardiology, so people having heart attacks coming to the hospital. They're sort of some of the top priorities, but there's multiple services that we currently provide that are just a bit uncertain at the moment.
So just so that I can get my head around this, like if you can't come to an agreement with the Minister for Health, are you saying that in a public system those procedures can't happen?
In a public system, they can happen, but they get far more centralised. So, for example, for a public patient, a lot of those services would be done at Royal North Shore Hospital. What we've wanted to do is to provide some of those services at Northern Beaches, and we haven't been able to in the past for public patients, but we have been allowed to for private patients. And in an ideal world, we provide all those services for all of our patients would be the ideal, and that's what we would love to get to, that situation in the near future. I suppose the difficulty is it's not really a negotiation at the moment. It's just trying to get our point across, and unfortunately, some people don't seem to be listening as well as they probably could. So it's not really a negotiation. We're just trying to give the information out at the moment and then see where we get from there.
There's a few texts coming in on the text line with people saying this sounds like private doctors are just wanting to protect their livelihoods. Is there any truth in that, Dr. Jollow?
Certainly not. I mean, ultimately, our local community on the Northern Beaches will need to be looked after into the future, and they will be looked after by the doctors in the area. But they could get taken to other hospitals. They could get on long waiting lists at Northern Beaches, because if it becomes completely public, then the waiting list will get much longer. But also, they might need to move to other areas, to other hospitals to get looked after. So, to be completely honest, the private doctors would like to look after the patients in their local area, because most of the doctors are local members of the community and want to work to look after people locally. But in the end, these patients will either go on a long public waiting list, or they'll be taken to other hospitals to be looked after, because that will be the most appropriate thing for them to do. So, just because doctors are saying that this is going to change, there's still going to be the same amount of work in the area. So it's not about us, looking after our private incomes. It's about looking after our community locally.
Dr. Jollow and Dr. Scomps, thanks very much for joining me.
Thank you.
Thanks for your time, Chris.
It's Dr. David Jollow, obstetrician and gynaecologist at Northern Beaches Hospital, and Dr. Sophie Scomps, the independent MP for Mackellar. And the Minister for Health, Ryan Park, will be on the breakfast program ahead of that meeting with Dr. Jollow and his colleagues tomorrow at Northern Beaches Hospital. But you can listen to the Health Minister on breakfast with Craig Rucastle tomorrow.
G'day, Patrick Stack here. Did I mention it's an Ashes year? Well, it is. Sports Daily is the best way to get the latest